Diagnosis is not the end, but the beginning of practice. A quote from German-born American physician Martin H. Fisher. Good afternoon, assessors and members of the negative team, and welcome to today's debate. My name is Melanie, and I am the first speaker of the affirmative team. The topic at hand is that to treat psychopathology, it is essential to make a diagnosis. As the affirmative team, we strongly believe this to be true. But first, what is psychopathology? As defined by the American Psychological Association, psychopathology is the scientific study of mental disorders, including their theoretical underpinnings, etiology, progression, symptomatology, diagnosis, and treatment. There is a reason why the word diagnosis is actually in the definition of psychopathology. This is because a diagnosis is fundamental to delivering effective treatment to an individual. Without one, how do we know what treatments to use? Do we just try something and hope for the best? Do we use these vulnerable people as test subjects until eventually maybe something works? Meanwhile, these people may be suffering beyond comprehension, and on top of this, feel completely invalidated by our lack of professional answers to their questions. As the affirmative team, we assume that when the topic refers to treatment, it is alluding to effective treatment. What it comes down to is that treatment without diagnosis is not effective treatment. By skipping the process of diagnosis, it can potentially even further endanger the individual instead of helping them. Additionally, the term diagnosis is defined by the American Psychological Association as the process of identifying and determining the nature of a disease or disorder by its signs and symptoms through the use of assessment techniques. Like psychopathology itself, diagnosis is also a fluid concept and falls onto a spectrum. There are different severities of diagnosed mental health disorders, and they can be coexisting. Diagnosing someone is not simply putting a label on someone. It allows for both patients and practitioners to have a clearer idea of what is going on and to allow for the implementation of appropriate treatments. Our second speaker, Madison, will be discussing how through diagnosis, individuals are able to gain clarity about their own health and find comfort in the knowledge that they are not alone. Our last speaker, Callum, will be summing up our team's points, rebutting the negative team's arguments, and leaving you without a doubt that in order to effectively treat psychopathology, it is essential to make a diagnosis.
I'm Zali, the first speaker of the negative team. We oppose the argument that it is essential to make a diagnosis to treat psychopathology. For an array of reasons, we believe that this is not true. When people present in a crisis, ideally, you'd want to be able to manage the symptoms before waiting for the lengthy delays in diagnostics. In the case of physical disorders, where perhaps someone has come into the emergency department stating they have pain, you wouldn't wait to see the diagnosis, you'd treat the symptoms. So why does this change when it comes to mental disorders? Is it not as important when it relates to the mental side of things? I argue that it most definitely is. Misdiagnosis also plays a factor. For example, bipolar disorder can be mistaken for schizophrenia. In the case of misdiagnosis, how does this make the patient feel when their treatment isn't working? Another point I want to make is that by making a diagnosis, perhaps prematurely, it can lessen or degrade the personal experience of the disorder. The nature of diagnosis itself is a set of symptoms and treatments, things that are rarely black and white, which is why it averages 8 years for a bipolar diagnosis. If we treat the symptoms, we can alleviate what we can whilst the diagnosis is being worked on. Waiting for clarity is not wise when someone needs help. If there is a premature diagnosis, the clinician may inadvertently fall for the trap of confirmation bias. Once a diagnosis is picked, it is quite difficult to change from that, when often it hasn't added anything substantial to the patient's treatment. Not to mention the fact that often people have tried to self-manage their mental health and can present with multiple morbidities such as alcoholism or drug abuse. Western medicine has long focused on physical illness, and whilst it's improving, it is not geared up for the presentations of patients with mental illness. In the case of somebody presenting with suicidal ideation at an emergency department, the first line of treatment would be to protect them from self-harm, regardless of the cause of the suicidal ideation. In short, The symptoms should always be treated first, and then a diagnosis can follow later.
Good afternoon, Chairman, ladies and gentlemen. The notion of labelling someone with a mental illness is heavily stigmatised by being seen as something that can be used to discriminate and alienate individuals. We, the affirmative team, believe that diagnosis is fundamentally important to be able to treat psychopathology effectively. It is essential to distinguish that diagnosing an individual can be a very fluid process. But by actively deciding to make the decision, we can, 1, create treatment plans and accurate psychotherapy techniques based on research. 2, provide more aspect of comfort and solace, which helps the client understand and make sense of their difficulties. And 3, provide clarity and rule out other possibilities, as well as informing other healthcare professionals. The first speaker from the negative team has tried to tell you that diagnosing can mean we can view an individual through a narrow medical paradigm, suggesting that the diagnosis can be seen as some form of Barnum effect, in which vague and widely accepted phenomena are frivolously applied to someone's situation. Not only will this be incredibly invalidating and unhelpful, it violates the rules of ethics outlined in the Australian Psychological Society, which includes protection from harm, confidentiality, and deception. This brings me to my point of how reliable a diagnosis can be. Although historically diagnoses may seem unreliable, with the introduction of the DSM, we are able to provide a concrete assessment of issues and help therapists develop specific goals of therapy and assess the effectiveness of treatment. These tools emphasize the fact that there are various checks and balances in place to provide accurate information and diagnosis. Furthermore, in the New York Times interview, The Comfort of a Diagnosis, Dr. Lisa Sanders states, when people are unable to make sense of what is happening to them, they are not really healed. Diagnoses are fundamental collaboration between doctor and patient. And along this journey, coming to a conclusion is an incredibly gratifying experience. Through this process, individuals can obtain clarity about their own personal health and be able to take control by having solace in the knowledge that they are not alone through the label of their diagnosis, which instead of entrapping, provides a sense of empowerment, making it essential to have a diagnosis.
Good afternoon, everyone. My name is Maggie, and I'll be debating against the need for diagnoses to treat psychopathology today. Although the affirmative team believe that a diagnosis can provide clarity for a person, a diagnosis can actually cause the person to become more confused and overwhelmed due to the depth of information regarding mental illness online. Often, when initially diagnosed, a person will become engrossed in learning about their condition as a result of fear, need for acceptance, and overall curiosity. However, when faced with billions of information pages, a person may feel inundated with information, which can cause anxiety and stress. While education about one's mental health is encouraged and beneficial, over-consuming information may be harmful and leave the client confused. Every mental illness is different, and every person's experience of mental illness is distinct. Often, the information pages don't consider this and provide general symptomatology and advice, which can cause a person to doubt their diagnosis or take advice that isn't tailored to them, thus hindering their progress rather than helping. Ultimately, mental health diagnoses cause people to feel labelled, stigmatised, and often seen as their diagnosis rather than who they are as an individual. As Zali outlined, the dangers of wasting precious time diagnosing a patient when symptoms could be treated instantly without a diagnosis is very real. Similarly, the potential of misdiagnosing a person is common and a detrimental issue. This is demonstrated in a research study conducted by ANO et al. In 2021, in which 309 participants with severe psychiatric disorders were assessed, and it was discovered that more than a third of patients were misdiagnosed, a massive 39.16%. This discovery is concerning, as a misdiagnosis often causes a person's mental illness to worsen due to the wrong treatment being used and the person feeling misunderstood. Removing the use of diagnoses would reduce these feelings and benefit people who are already struggling with their mental health and don't need to feel further discriminated against. Treatment of mental illness is possible without a diagnosis and may be more effective, as the negative effects of a diagnosis would be removed. By focusing on a person's individual symptoms and experiences, treatment can be tailored to the individual to a greater extent. Making a diagnosis is not essential to treat the psychopathology. In fact, making a diagnosis is often doing the opposite of treating a person's mental illness, causing them mental strain due to the stress and stigma that comes with diagnoses.
Hi, my name is Callum. I'm the third speaker for the affirmative team. Firstly, I will rebut arguments made by members of the negative. Maggie mentions the concern that patients will feel overwhelmed, even confused by an abundance of information. I would argue that an abundance of information is actually a good thing. Patients, when presenting with symptoms of mental ill health, often do not know what is happening to them, why they are feeling the way they are, or what to do about it. A diagnosis is essential in these cases as it then allows them access to information, such as what they can do about it, how they can help themselves, what treatments or supports are available, and how they can help others in similar situations. While yes, the internet is sprawling with information, patients aren't going to be reading all of it. And a lot of it reinforces the same points with the best possible information often pushed to the top. I acknowledge that information pages don't consider individual differences, and this is because they can't. It would be impossible. Yet many provide different possible scenarios that reinforce it can be experienced in different ways, and that their experience is of no less importance than the next person. Maggie also mentions the idea that diagnoses can cause people to feel stigmatized. I argue that a lack of diagnosis only worsens experiences as it is in reinforcing denial and ignorance. The only way to prevent stigma is to tackle it head on and continue to diagnose these illnesses so they become normalized, thus reducing the stigma. The DSM is a universally accepted measure of diagnosing mental illnesses. They are an objective guide which allows for different clinicians, even across cultures, to consistently arrive to the same conclusions. This is an essential part in the effective treatment of different disorders, as consistent diagnoses lead to treatments which work. Diagnoses are not rigid and limiting. They provide patients with multiple pathways to recovery that they would not have been exposed to if they were not diagnosed. Diagnoses are essential when treating mental illness, as we, the affirmative team, understand that psychopathology is fluid and comes on a spectrum, and we would argue that diagnoses operate in the same way. Diagnoses are essential as they are the only tried and tested method of successfully and effectively aiding problems in recovery. Diagnoses are essential as they provide patients with clarity and comfort, knowing what is wrong with the way they are feeling and knowing that there are steps they can take toward recovery. Diagnoses are absolutely essential for effective recovery.